this isn't just about blood and lungs, and like this isn't just biology. Like biology is affected by the way that we think. It's a piece of us being human. What would you say, walk me through your thoughts on people, because I'm sure that you've seen some people with an attitude and you're like, they're going to win. And there's other people that you're like, gosh, I'm so concerned about them because they don't have the right attitude and I can't seem to get them to have the right attitude.
Sometimes families will give them the right attitude,
Mhm.
they're down, and sometimes just people coming in, just like, oh, you have cancer. I mean, it's horrible. I mean, that's like the worst thing that you can hear, that, you yourself have cancer or a member of your family or loved ones have cancer, and they have all these, preconceived notions, Hollywood and, by the way, most of the oncologists that you see in movies are such jerks. They're just so, but anyway,
That's so
we
funny.
won't
That's actually a
yeah,
question that I ask
Larry,
a
yeah,
lot of the people around. Like, what do you see in a movie that drives you completely nuts?
that they're just like, I'm sorry, there's nothing more I can do for you. Next patient, please. Yeah, yeah. So,
Oh man.
so
So do
what we
you
were
ever
talking.
try to, when you talk to the family, do you try to get the family to provoke the patient?
No one could be treated against their will, but you were just talking about attitude. Sometimes, when they come in, I can tell them, like, yes, it's horrible that you have cancer, but do you realize your cancer is driven by an ALK mutation, and I'm going to treat your cancer, with a pill, and we're going to be sitting here hopefully in 2, 3 years. I don't know what's your fate, but that's it's completely foreseeable and feasible, or we're going to treat you with, a immunotherapy, and again, we're going to be here in 6 months and a year, or 2 years. We will see. I don't know your fate, but we need to fight this. We have to be a warrior here. So, once people hear that, they're excited, and their attitudes change. And I mean, there's someone who even wrote a book about this. Someone that met me, a young, someone who was diagnosed very young, with lung cancer. I don't know if I should mention names or whatever. His name is Jeff Julian. Well, he's posted about this, on social media, and he's the swim team coach at USC.
Oh,
Um,
nice. Okay.
um, anyway, he was diagnosed with cancer at a very young age, like, when in his 30s. He spoke to, 4 or 5 oncologists before seeing me. And, his whole idea was, he had already given up his hope, and hope is something that you should never give up. And then he met me, and I had that exact conversation with him, just like I just talked about, you can be treated with, immunotherapy, and there's no reason why you can't be among those patients that are going to be with us. And he said that changed his entire life. I didn't even end up being his treating physician, because I didn't have the clinical trial that was available. It wasn't yet open at my institution, so I sent him to UCLA, and he got, those very drugs that we just talked about. And this is years later, and he's still alive, and he even wrote a book about, never
That's
giving up
fantastic.
hope. Yeah, here I have the book
Yeah.
right here. Process of
Oh,
hope.
very nice. Okay, cool. When people give up hope, it's because they assume that they actually know something. And most of the time when you dig down, you find out that they've just made an assumption,
Yeah.
and they don't actually know. They just think, and it's more emotional than it is factual. Okay,